Every day, Sarah Morgan risks going to jail by treating her multiple sclerosis with cannabis. She says it's worth the risk because of the relief it gives her. But does that give her the right to break the law? Tonight, Sarah tries to find out why trying to ease her pain has turned her into a criminal.
What I am preparing is cannabis hot chocolate, and it's how I survived the symptoms of MS. So I ground up some cannabis bud.
Sarah is breaking the law to ease the terrible pain of everyday life.
Just half a teaspoon is enough. And it will keep me pain-free and spasm-free for about 3 hours.
Sarah suffers from multiple sclerosis, a chronic, disabling disease that attacks the central nervous system. Symptoms vary from person to person, but for Sarah, even attempts to make the simplest movement can cause her agonising pain. The cannabis gives her some relief.
I can feel now my legs are freeing up. When I wake up in the morning, my knees, my ankles, I have all these muscles pull my leg to the left, so I find it hard to walk straight. With cannabis, these symptoms recede to a point where I can walk okay-ish. Still hard work, but it is very much easier.
But although cannabis makes her life easier, it also makes her a criminal. And Sarah's fed up with the law and wants the system changed.
I want politicians to be nice to me. I'm sick. Can you tell me, out there you're watching this on television, how this is causing you harm right now?
The law says cannabis is illegal because it's harmful. So is Sarah doing more damage than good? We're going to follow her on a journey as she tries to find out. At St Mary's Hospital in London, a doctor has been studying the damage smoking cannabis, either on its own or with tobacco, can do to the lungs.
I've got here a scan of an 18-year-old cannabis smoker, and this grey bit here is normal lung. And if you can see, just at the tips of the lungs are black bits. Now these are basically holes in the lung that should have normal lung in them, that are what we would recognize as smoking-related emphysematous change, emphysema. And what's striking is that this is occurring in a very young individual, and I would expect this in a much older, chronic smoker. Show that when you do
but Sarah doesn't smoke cannabis, she vaporizes it. But is that safe?
So the key question is, what exactly is being vaporized, and are those compounds in themselves safe or unsafe? I think that's the bit I don't know yet.
Even the experts can't say for sure whether vaporizing cannabis is doing Sarah harm, but doctors also have serious concerns about the psychological damage cannabis can do.
I use cannabis to treat my multiple sclerosis. Just what risk am I taking to develop psychosis?
Well, the study suggests that people who regularly smoke cannabis double their risk of psychosis. But psychosis is quite uncommon, perhaps affecting about 2 to 3% of people in their whole lifetime.
Well, the risk doesn't concern me as much, because there are lots of risks in available pharmaceuticals that I would have to take for my condition. So the risk doesn't concern me. If it's that small, what is all the fuss about?
Overseas, things are very different. More and more countries allow the prescription of raw cannabis, including 13 US states. Sarah's travelled to somewhere where they're pioneering the medicinal use of cannabis, the Netherlands.
There it is, in a little tub. Why can't we have this system in the UK as well? Very simple, and it works.
Sarah's been given permission to visit a secret location in the Dutch countryside, where they grow thousands of kilos of cannabis every year. The drug they produce as medication is used not just in the Netherlands, but in countries right across Europe.
What do you think about the situation in the UK?
What you see happening is that patients who are in need of cannabis are buying uncontrolled substances.
Frequently contaminated.
And frequently contaminated with pesticides and even heavy metals or other stuff to make it way more.
In the Netherlands, Sarah could get cannabis that's clean, but in Britain she's at the mercy of unscrupulous drug dealers. Dutch people still require a prescription to obtain medicinal cannabis, so Sarah's come to see a doctor to see if he will prescribe it for her.
Can you prescribe me medical cannabis?
It depends on the circumstances.
But this doctor has some serious concerns about prescribing cannabis for Sarah, and that's because she's not even tried the legal treatments for MS that are available back home in Britain.
Because you have never tried the regular medication, it will be difficult for me to prescribe medicinal cannabis.
Sarah believes regular medication would give her side effects like high blood pressure, mood swings, ulcers, and even the risk of heart failure and psychosis.
I just don't want to take the route of taking 13 pills a day when I can just use one medicine, cannabis, and I feel fantastic using it. The Netherlands is not the promised land I once thought it was. I mean, I can't go there and get my medicine without taking the pharmaceutical route first, and that's undesirable for me. I'd rather take the risk of breaking the law than go through that.
Sarah refuses to take any other drug for her MS other than cannabis. She's convinced that allowing it to be prescribed in its raw state on the NHS is the only way to effectively ease her symptoms. She's going to see a government advisor in the House of Lords to find out whether it's likely that that's ever going to happen.
Why can't I get herbal cannabis as medicine here on the National Health Service?
Well, currently herbal cannabis anyway, the obtaining it is outside the range of the law. But I think the problem in the longer term is around quality control, dose control, knowing exactly what strength people have. And the other one is the issue about leakage onto the illicit market. To look at getting herbal cannabis available is probably not going to happen in this country.
How come other countries offer it to patients in its herbal form, but Britain doesn't?
You can look at another country and say, they do that, why can't we do that here? But you have to look at it in the context of the whole healthcare system, the whole regulation, also the philosophy of the society in which they're operating as a healthcare system.
It seems there's little prospect of Britain joining countries like the Netherlands in the prescription of medicinal cannabis. And so, despite what the experts have told her, Sarah is determined to continue breaking the law to ease the pain of her MS.
I'm not put off cannabis for my illness because I've done all the relevant research that's available in other countries. Cannabis has very strong medicinal value that will be a great benefit to very many people if it's made available.
Well, that's it for tonight, but don't forget you can watch the whole programme again on the BBC iPlayer. Just go to our website, bbc.co.uk/InsideOut. Coming up on the programme next week, we ask